This is just the beginning.
Welcome to the virtual event for Axios Latino, Adversity in Healthcare and Vaccinations. I'm Stef Kight. I'm a politics reporter for Axios, and I'm coming to you from Arlington, Virginia. Thank you to Bank of America for making this conversation possible on closing gaps to health access in Latino communities. Welcome to our audiences on Facebook, YouTube, Twitter, LinkedIn, and Axios.com. You can join the conversation on Twitter with @Axios or using the hashtag #AxiosEvents. Over the next 30 minutes, I'll be joined by my stellar colleague, Russ Contreras. We'll be discussing how Latino leaders are working to amplify healthcare resources and build confidence in vaccines, especially in at-risk communities. Our first guest is the representative of Texas' 16th Congressional District, Representative Veronica Escobar, joining us from El Paso, Texas. Welcome, Congresswoman.
Hi, Steph. Thank you so much for having me.
Great to have you. I had the opportunity to sit down with you in El Paso back in April with my colleague, Russ, who will be joining the event later on. And even then, you were already talking about the need for more vaccines, calling on the government to provide more vaccines to El Paso, emphasizing the importance of that community on the border. Walk me through, did you get those vaccines, and how have the challenges changed when it comes to vaccinating and protecting your constituents since then?
Well, binational communities and international communities are really unique in that we are interdependent. Our economies are linked together, our families are linked together, and it's very hard not to act as a region. When we don't act as a region, then we face additional challenges. And from the get-go, Steph, actually since last year, since 2020, I had been calling on the federal government to have a specific plan for binational communities on the southern border as well as the northern border, because people still go back and forth. No matter how much you try to shut a border down, there is still essential travel that happens. And so we have to have uniformity on both sides of the border, and we have to have resources surged to make that equity happen. And we saw in El Paso last year that we became a national hotspot. We were a national hotspot for a couple of reasons. Number one, we know that Latino populations are especially vulnerable because of lack of access to health insurance, lack of access to primary care, and the high rates of being essential workers. But also because we're on the border, and because Mexico at the time was not testing, tracing, and mitigating at the same levels, we were even doubly at risk. So in April, when I was calling on the administration to surge more vaccines to El Paso, we did get support from FEMA. We did get some additional resources, which was great and badly needed. And El Paso responded so incredibly. It's what has made us one of the communities, not just in the state, but in the nation, with the highest vaccination rate.
As you pointed out, there still is plenty of transit between Mexico and Texas and through El Paso, even with essential travel only allowed through the border right now. Would you just speak to how important is it for Mexico to also have access to vaccines, for those communities on the Mexican side to also be protected, both to protect those communities, but also communities like El Paso?
It is imperative because everybody wants those ports reopened. Well, maybe not everybody, maybe Donald Trump is secretly happy about this, but everybody in our region wants these ports reopened because they are key lifelines to our local economy. We've seen long wait lines for students who are coming over to study. You know, the University of Texas at El Paso offers in-state tuition for Mexican nationals. It is an international campus, but young people are having a hard time getting across the border in a timely manner. We've got to get those ports reopened. And the quickest way and the safest way is for Mexico to do as well, specifically our sister cities right across the border, like Ciudad Juarez, for them to do as well as El Paso has been doing. We have great collaboration between the two communities. And as we've seen in San Diego and Tijuana, here in El Paso and Ciudad Juarez, we had a program to help offer vaccines that were about to expire to Mexican maquiladora workers. And the response was fantastic. I was able to help the county secure permission from the White House in order to make it happen. And we all know that we're in this together. Our region is one region, and the more that we act like that, the better. So really, the more that every administration understands that, the better equipped we will be. But what we saw during the Trump administration was not just a lack of a national plan, but a lack of a binational plan. And that's when I filed my Binational Health Strategies Act, so that we arm the agencies that are intended to respond to this, that we arm them with staffing, with resources, and that we can prevent the mishaps of last year from ever occurring again should we have a future pandemic.
Is there more the Biden administration should be doing to help Mexico get Mexicans vaccinated? You pointed out the White House, approved your plan to help get some of those vaccinations to people who would be crossing the border. But do you think there's more that the Biden administration should be doing with Mexico?
That plan, by the way, Steph, was the County of El Paso's plan. And so I was happy to support and help. But it really is a testament to what happens when you empower local communities. They will come to the table with solutions. But I have been in conversations with Dr. Pritesh Gandhi, who's the Chief Medical Officer of the Department of Homeland Security. And he's been such a great partner to work with. And he agrees that we need to have really a binational plan, not just on the northern border, not just on the southern border, but on the northern border as well. I do think it will take legislation, however, so that we can solidify this so that no future administration can ever neglect critical border regions.
One thing that I want to talk about, and it can become a contentious issue at times, and we've seen this in the news some, is the issue of migrants who are crossing the border illegally, crossing and then getting COVID. And I want to have you just talk a little bit about how big of an issue that really is, and what needs to be done to ensure not only border communities are protected, but also that migrants who are often seeking asylum are also kept safe from coronavirus.
You know what is so perplexing, Steph, to me anyway, is that the very same Republican leaders who are complaining or trying to scapegoat, rather, migrants for bringing in COVID are the same Republican leaders who don't care that the American unvaccinated public is spreading COVID. So to me, it really demonstrates that this is more of a fueling of xenophobia and scapegoating than a true public health concern. But let me be clear. The data does not prove their claims or their accusations. The highest levels of leadership at the NIH have repudiated these claims by Republicans and some Democrats who are claiming that migrants are bringing COVID across the border. Here's what is happening. The administration is responding as best possible to ensuring that those migrants who are seeking refuge and asylum in our country, that they are quarantined if they test positive. With the unaccompanied minors, there's an effort to ensure that they get vaccinated, as well as other migrants get vaccinated. It's in our best interest to have every person possible across the globe vaccinated, especially those closest to us. But all of this really, truly is more of the Republican xenophobic, racist attempt to scapegoat.
So you would say that you think we need to protect migrants, but we're doing enough in ensuring that they're vaccinated and quarantined when needed?
We can do more, but part of what's standing in the way, Steph, is our own governor. The federal government has tried to provide communities with FEMA funds to ensure that local communities can more adequately test, trace, et cetera, migrants, and we have a governor who has rejected that funding. So could the administration do more? I think they're doing absolutely everything possible to ensure that migrants are tested. I do want them them to do more, but we need also a collaborator and a partner in state leadership.
Speaking of the governor, I do want to get your reaction to the recent news that Texas Governor Greg Abbott did test positive for the coronavirus. He was, vaccinated, but has also been pretty loudly opposed to mask mandates. How do you think this news impacts Texans' willingness to get vaccinated? And does it do anything for those who have maybe been more hesitant to believe in the seriousness of COVID?
I hope that it's a wake-up call for many Texans in terms of getting vaccinated. But I also hope, Steph, while I wish the governor a very speedy recovery, I hope it's a wake-up call for him as well. He has the incredible privilege of convalescing in a mansion with staff. He has the ability to take time off from work. He has access to the best medication. Allegedly, he had a third vaccine, something not available to Americans right now. And so I hope that while he is convalescing with the best care around him, he realizes that the vast majority of Texans don't have that, and that he has a change of heart as when it comes to the approach.
Well, thank you, Congressman Escobar, for joining us on Axios, and I appreciate your time.
Thank you so much, Steph.
Next, we have a View from the Top segment with my colleague, Chief People Officer at Axios, Dominique Taylor.
Now joining us is Bank of America's Chief CRA Officer and Community Banking and Development Executive, Alberto Garofalo. Welcome, Alberto.
Thank you so much. We want to start this. Good afternoon, Dominique. It's great to be here.
Alberto, can you tell us about your role at the Bank of America?
I'd be delighted to tell you about all of the roles that I play for Bank of America. I am the Chief CRA Officer for the bank, and in that capacity, I work with the 8 lines of businesses leading an integrated program centered around initiatives including deploying capital, helping create jobs, developing communities, fostering economic mobility, and supporting our teams in addressing society's biggest challenges. I also am the Community Banking and Development Executive, and as part of that, I lead the Community Banking and Hispanic Latino Strategy for Consumer and Small Business. And I am President of Bank of America for New Jersey, where I'll help deliver one company across the great state of New Jersey. And then lastly, I also co-chair the Hispanic Leadership Executive Council, which is really working with over 230 of our senior-most Hispanic leaders to influence strategies focused on talent, social responsibility, and responsible growth.
And Bank of America has committed $1.25 billion towards driving racial equality and economic opportunity. What can you share about this commitment?
I've got a lot to share about the commitment, and we're delivering on the $1.25 billion commitment over a 5-year period to specifically advance racial equality and economic opportunity. And frankly, it's been recently expanded. Initially, it was a $1 billion 4-year commitment. And look, this effort further accelerates the work already underway to create opportunities for people and communities of color. Through direct actions, investments, and work to catalyze similar efforts across the private sector. It includes things like financing, philanthropy, and the focus is primarily on jobs and reskilling, affordable housing, health, and small businesses. Now, to date, we've deployed more than $350 million already, including equity capital investments in 17 minority deposit institutions and community development financial institutions, MBIs and CDFIs, and $250 million for equity investment in minority-focused private equity funds, with 90 funds to date.
And can you talk about how that commitment is directly benefiting the Hispanic Latino community?
I'd be delighted to, yes. Look, we announced a $25 million commitment to enhance upskilling and reskilling for Black and Hispanic Latino individuals through partnerships with 21 higher education institutions, $10 million to Hispanic serving institutions, HSIs. They include community colleges and HSIs, and I want to mention all of them because I do think it's important all of these play a very critical role in really supporting this really important initiative. We've got Arizona State University, obviously in Phoenix, Arizona, Baruch College, University of New York, Dallas College in El Centro, Dallas, Texas, FIU, Florida National University, Miami, Florida, Cal, Washington, City Colleges of Chicago in Chicago, Los Angeles Trade Technical College in Los Angeles, Miami-Dade College in Miami, Florida, Prima Community College in Tucson, Arizona, Riverside City College in Riverside, California, and University of Puerto Rico in Rio Piedras campus in San Juan, Puerto Rico. And also, as I mentioned earlier, one of the 17 MDIs and CDFIs is Bonsafe Bank in the South Bronx, which provides financial services to the Puerto Rican community. But these investments will facilitate benefits across multiple states and in the communities that these institutions serve through lending, housing, neighborhood revitalization, and other banking services. We also continue to partner with organizations like Unidos US on the Latinos in Finance program, recently increasing our investment by more than $1 million to expand the program to 16 markets in order to assist Hispanic Latinos navigate career pathways in financial services. And I have personally been involved with this program since the first market, so it's great to see the expansion and the commitment and the partnership. We've also committed $750,000 to the Hispanic Scholarship Fund, which is a national nonprofit supporting Hispanic American higher education, providing scholarships, programs, and support services to Hispanic Latino students to acquire a college degree, bringing our total funding to $1.4 million since 2008. And look, there's more. We're also supporting progress for Hispanic Latino community through partnerships such as, I mentioned Unidos US already, the U.S. Hispanic Chamber of Commerce, the Congressional Hispanic Caucus Institute, and Latitude. And a number of these organizations have conferences which take place during Hispanic Heritage Month, which we're all looking forward, and it's coming up here in September. And as an example, Bank of America has committed $1 million and will serve as the premier title sponsor for the September 2021 Latitude Virtual Conference, which is going to be held, of course, during Hispanic Heritage Month, and focus on the many ways that Hispanic Latinos are driving the new mainstream economy. Of course, in the U.S., whether it's from business to media to politics to science and technology.
And obviously the pandemic right now is top of mind, and reemerging again is even more top of mind. So can you tell us some of the ways that Bank of America has helped the individuals and the communities that are impacted by the pandemic?
Yeah, absolutely. Look, we've been there from the beginning supporting our clients in every way. Through our client assistance program, we provided payment assistance to our consumers and small business clients. We've ensured that we've had access across our entire network of financial centers, ATMs, and of course, our always-on digital capabilities. Bank of America also committed $100 million immediately after the start of the pandemic to help communities through the shutdown. We donated over 29 million masks to underserved communities across the U.S., and we formed a partnership with CVS Health on no-cost flu voucher program for under-resourced communities. And you might have seen we issued a $1 billion corporate social bond to support the fight against coronavirus.
And what of the support how much of the support has actually benefited the Hispanic and Latino community specifically as well? I'd love to hear more about that direct work.
Yeah, absolutely. I'll start with perhaps a few examples, Dominique, that I think speaks to your question on how this has specifically benefited our Hispanic and Latino communities. For example, AltaMed began as a grassroots organized neighborhood health clinic in 1969, focused on providing Southern California's Latino community with healthcare. Our support of $500,000 grant is helping it continue to provide emergency dental and senior services to its 300,000 plus patients. We also have El Rio Health Center in Tucson, Arizona, providing access to comprehensive medical care for some of Tucson's most vulnerable citizens, including the homeless and uninsured. Our grant of $15,000 helped create El Rio's Health Center Foundation, set up specific coronavirus care areas at their 8 regional health centers, establish a critical telehealth platform, and deploy healthcare workers into the Latino community to screen individuals at senior care facilities and homeless shelters. And then we've got Kern County Superintendent of Schools Education Services Foundation, which provides educational resources to 40,000 primarily Hispanic low and moderate income students in the Bakersfield, California area, a community that is struggling with unemployment and poverty levels well above the national averages. And our 75,000 grant helped the organization purchase 21,000 Chromebooks for students, while also providing internet connectivity to support distance learning.
Thank you, Alberto. I've really enjoyed learning more about your role, the work that Bank of America is doing and has been doing, especially with the pandemic and the way it's impacting the communities, and that you all are really making a difference. Appreciate this conversation.
Thank you. I appreciate the opportunity for being here.
And thank you to Bank of America for sponsoring this. And now on to our next conversation.
Thanks, Dominique. I'm Russell Contreras, and I'm the Race and Justice reporter for Axios. Our final guest is practicing cardiologist and chief medical correspondent at Univision, Dr. Juan J. Rivera. He's joining us from Miami, Florida. Dr. Rivera, it is a pleasure. How are you doing today?
I am doing well, Ross, and I appreciate the invite. Thank you.
Before we get into the discussions about COVID-19 and vaccine today, take us back to when you grew up in San Juan. When did you make the decision to pursue a career as a doctor? Why medicine and why the heart?
I think that for Hispanic people out there, they'll understand this comment. My mother decided for me, basically, that I was going to be a doctor. I think that having no doctors in my family, I truly mean it. My mother wanted me to be a physician. I had some interest in science when I was approximately 15, 16 years old. I experienced palpitations and I experienced arrhythmias, and I had to get medical care for that. That led me to be extremely curious and interested in cardiology, in how the heart functions. And that was enough, along with my mother's insistence, for me to go to medical school. I'll tell you, the first year doing embryology, anatomy, and histology, I wasn't a big fan, but I stuck with it. And when I started physiology the second year, how the body actually works, I fell in love with it. And then during my third and fourth year, when I started taking care of patients even more, I'm a people's person.
Now, as you know, before COVID-19, heart disease was the number one killer among Latinos for a variety of reasons. Why is heart disease such an epidemic among Latinos? What is it about us genetically, our diets, our behaviors that makes heart disease so problematic for us?
Ross, I want to point out that heart disease is the leading cause of death in white Americans as well, African Americans, Hispanics. The risk factors that contribute to the development of plaque in the coronary arteries, which eventually lead to a heart attack, are very prevalent in these communities. Talking about the Hispanic community, what are those risk factors? Obesity, diabetes, hypertension, not exercising, smoking. A lot of those risk factors are very prevalent in the Hispanic community. If you couple that with the fact that there are way too many Hispanics that don't have access to primary care in this country, in other words, don't have the opportunity to target those risk factors, that combination is deadly, and it leads to a significant incidence of myocardial infarction or heart attacks, and a significant prevalence of heart disease.
When the pandemic hit last year, we saw Mexican Americans in the Southwest, Puerto Ricans in New York, Central Americans in Washington get the virus at a disproportionate rate. It exposed some inequalities in our healthcare system. Why were Latinos and Native Americans so vulnerable to COVID-19 when it hit us immediately?
It's really sad, and there's a lot of factors. I think, Ross. I think that number one, as we were saying, it's a population with less access to primary care and preventative care. So when it comes to diabetes, heart disease, hypertension, obesity, which now we know are risk factors for severity of COVID, the prevalence of those in the Hispanic community are tremendous. So it attacked a vulnerable population to begin with. When you look at Hispanics in the US, you have a significant percentage of them who work in the service industry. They couldn't stay home and work from home. You have a significant percentage that relies on public transportation. And obviously, we know that those are risk factors when you get exposed to more people in a closed environment. That's going to increase our likelihood to get COVID. I think that you have Hispanics living in New York, for example, that in one apartment, you're going to have a family of 6 or a family of 7. And the most common risk factor or the most common way in which people got COVID in New York was actually because someone was bringing it home. You would get it at home. I think that those are all elements of our culture and our reality as a group that made us significantly more vulnerable. Is there a genetic element as well? It could be, but that hasn't been discovered yet.
Now, with vaccination rates, we're starting to see Latinos in urban areas do pretty well, whether it's Houston or New York. But places like East Las Vegas, the vaccination rate among Latinos is still hovering around 30%. What is driving this vaccine hesitation in our communities?
I think there's a lot of misinformation and disinformation, Ross, out there in social media, on the internet. Remember, if you have, let's say, 25, 30% of Latinos, including undocumented immigrants that don't have access to having a conversation with a primary care doctor, that's going to be their source of information. So it's very easy for them to encounter misinformation. From day one, that's exactly what I've been doing, trying to inform the Hispanic public via Univision, via my own social media. And let me tell you, one of the reasons why that was so important is because when this pandemic hit, we would get press conferences from the White House, from Dr. Fauci and experts. Guess what? Those were not translated to Spanish. You couldn't get information at the White House website about what to do, what to take, who to call. The same with the CDC, quite frankly. They have some information in Spanish, but that information was not getting to our people. It wasn't getting to the Hispanic community. And in the absence of that, they rely on other sources that we know now that have created a lot of problems with misinformation. So I think for the next pandemic, it's going to be very important to realize that all of those are elements that will make minority groups more vulnerable, and that it's going to be important to make sure that they're getting the information. When it comes to the vaccine, all of that misinformation obviously played a role. But let me tell you, the pandemic has been so politicized that 5 months ago, 6 months ago, someone should have said, you know what, we need to provide primary care doctors in every community with the ability to have the vaccines, because Americans trust their doctors. And it is more likely that I have a conversation in my clinic with a patient one-on-one and convince that patient to have the vaccine as, for example, any celebrity or any public or official or politician, because there's a significant distrust. To this day, it is very difficult for primary care doctors to have access to the vaccine. I think that has been a huge mistake.
In our final 2 minutes that we have left here, this is the 500th anniversary, 500th year anniversary of the fall of the Aztec Empire. And I mention this because after the encounter, the continent was hit by disease. The indigenous populations were hit by horrible disease from Mexico all the way down to Peru. We were birthed by disease. It is generations of trauma. Why is it so difficult for us to explain that we are a people that were birthed out of disease, and now we're facing another traumatic event that could define us for generations? Why isn't this being explained that, look, this has happened to us before, we can prevent it now?
I think that we're going to have to concentrate moving on in terms of explaining to Hispanics the importance of preventative healthcare. But the government has to also provide access to those individuals that don't have access at this point in time. Preventative health, Russ, is everything. We have to understand that because we were not doing our part when it comes to making sure that these risk factors were on check, we were hit disproportionately. So I think that needs to be fixed moving forward. The last thing I'll say, because I know that there's not a lot of time left, there is also a tradition, or there's also a history of minorities not trusting authority when it comes to research, because we have a history of using minorities for research that we now know was unethical. And people don't forget that.
Preventative care, you're right. I've got my preventative care aspirin for my heart. So thank you so much. Dr. Rivera, thank you for joining us. We appreciate it. We hope to have you back soon.
Thank you, Ross. It's a pleasure.
And thank all of you for joining this afternoon for another virtual conversation that has made everyone smarter, faster. Thank you to our sponsor, Bank of America, for making events like this possible. For more information or to sign up for our Axios Latino newsletter, visit axios.com/newsletters or go to our Axios app. Thank you all for joining, and we'll see you soon on axios.com.